next speaker is Dr. Barry Levy. He's a friend, a physician, an epidemiologist. He is known for his work in public health around the world. He is also known for the topic of his discussion today, and that is asbestos exposure in post-war recovery and reconstruction activities. He's written a book about this. He's co-edited a couple of other books, and we are very pleased to have him to talk about this important topic, especially in today's world. Barry.
Thank you very much, Christine. I'm very pleased to be here with all of you and to honor the legacy of Dr. Selikoff and the work of ADAO. Two of the greatest threats to the public's health are asbestos and war or armed conflict. And yet, surprisingly, almost nothing has been written or spoken about these issues, especially asbestos exposures for civilian populations. I've been working on these broad issues for many years. I started work on asbestos in 1974 when I did a study of cancer in the population of Duluth that was drinking water heavily contaminated with asbestos from an industrial source. And I started working on issues related to war and its adverse health effects for civilian populations when I worked in a Cambodian refugee camp in 1980. But it was not, contrary to what Christine said, it was really not until recently that I began to appreciate the frequent occurrence of asbestos exposure to civilians during war and its aftermath. My experience is reflected in a recent PubMed search where I did a literature search where I put in the terms asbestos and armed conflict. By the way, if you put in the term war, you'll get the war on cancer, the war on drugs, and so forth. So I put in the term armed conflict, and it only got 19 hits, so to speak. There were 19 journal articles that came up in this literature search. 12 of them actually had to do with the World Trade Center, and none of the other 7 had anything to do with asbestos exposure during war. During the past few years, fortunately, there has been a lot more attention to the environmental impacts of war in general. These include, but are not limited to, contamination of air, water, and soil, the adverse effects on the built environment and the natural environment, as well as on, and as part of that, the effects on animal habitats and ecosystems, and the so-called remnants of war, which include anti-personnel landmines and unexploded ordnance. So these create hazards for people who live, work, farm, or pass through areas in which landmines have been deployed or unexploded ordnance have been present as a result of war. Up until now, though, asbestos has not been regarded as a remnant of war, although arguably it's probably the most hazardous and the most prevalent remnant of war. Military exposures to asbestos have been well known for many years. In ships, in planes, and tanks, and barracks, not only for the military personnel themselves, but the civilian workers who build and maintain much of this equipment. Naval vessels have insulation, fireproofing gaskets made of asbestos. It's present in boiler rooms and engine rooms, in ammunition storage areas. In the Air Force, planes, of course, have engines and insulation, and barracks themselves that are contaminated with asbestos. The Army has structures and vehicles, many with insulation, brakes, clutches, gaskets, and wiring that are made of asbestos. But to a large extent, these military exposures have been reduced and controlled, and military personnel have been warned and generally protected. Not so for non-combatant civilian populations during war and its aftermath, mainly due to the destruction of buildings and other infrastructure. In recent years, just to give you an overview on war, there have been about 50 active armed conflicts a year around the world. About half of these have involved 1,000 or more deaths in a given year. Most of these wars are civil wars within countries, and mainly in low and middle income countries where asbestos has been used extensively in construction materials and has not been regulated very much. In many wars, military forces use as a strategy of war to target non-combatant civilians and civilian infrastructure. So it's not just by accident that civilians are suffer injuries and deaths during war, but in fact they're targeted, and so is civilian infrastructure, including homes, schools, healthcare facilities, office buildings, factories, and other buildings that contain asbestos. Asbestos is, as you well know, used much in building construction, in insulation, fireproofing, cement, roofing, sewage and water pipes, and much, much more. So when buildings are destroyed by explosive weapons like missiles and bombs and so forth, huge amounts and high concentrations of asbestos are spewed forth into the air. They become airborne, mainly short fibers in many situations. Of course, this was demonstrated with the World Trade Center disasters, especially with the collapse of the North Tower that has been said the first 40 stories were insulated with spray-on asbestos insulation. And of course, extensive studies on the level and extent of exposure and the health effects related to that exposure have been done in resource and recovery workers and the residents of Lower Manhattan and others, thanks to many scientists and others in this room from Mount Sinai and other academic institutions, from government agencies, and all of this with much strong government support. In contrast, the vast majority of war-torn countries do not have the scientific or financial resources to assess and respond to asbestos exposure from war. So there are many unknowns. We do not know the intensity, the extent, or duration of asbestos exposure to civilian populations during war, during the aftermath of war, during clearance of debris by rescue and recovery workers, during rebuilding and repair, during restoration, and during new construction. And we also do not know what we do not know. That is, there may be things that we're not even considering that may represent hazards. For example, just like there's a synergistic relationship between smoking cigarettes and asbestos exposure, there may indeed be additive or synergistic effects due to exposures between asbestos and other airborne contaminants during war. During the responses to war, particularly during war and the immediate aftermath, focuses on humanitarian and public health responses, provision of food, medical care, control of communicable diseases and communicable disease outbreaks, addressing mental trauma. And as a result, many opportunities have been missed to assess and control asbestos exposure, to warn and protect exposed populations, and to safely remove debris that has been contaminated with asbestos. So there are many challenges that exist that I've listed here to mitigate asbestos exposure in the immediate post-war period and during war itself. First is to draw attention to this hazard. A challenge, one of the challenges is to focus while so much focuses on addressing immediate basic needs of people and rebuilding society, there unfortunately has been very little attention to asbestos. And so we in the occupational environmental health community and the labor and environmental movements need to develop the popular and political will to make mitigating asbestos in the post-war period and during war itself a priority, not only with data, but by using stories, as ADAO has done so successfully. Second is listed here, the second bullet point. A second challenge is to characterize the intensity and extent of exposure. Where and when does it occur? Who are at the greatest risk? What activities in the post-war period and what circumstances likely lead to resuspension of asbestos dust? A third challenge is developing information and developing recommendations to protect workers and community residents, the general population, and to implement protective measures for workers who are removing debris, restoring buildings, constructing new buildings, and to protect the general public. That includes safety training with supervision of cleanup, restoration, and construction workers, making decisions about respiratory protection, ongoing monitoring, screening, ongoing public health surveillance for adverse health effects, and decisions about whether to ban entry into certain areas and buildings. And importantly, who's going to make these decisions and who's going to implement them? And is there going to be community input in making those decisions? Beyond these considerations, we need to look upstream for opportunities to prevent asbestos exposures during war, and certainly efforts to ban the use of asbestos globally will lead to long-term benefits. In the short term, we need to look for ways to improve enforcement of the Geneva Conventions, which ban attacks on civilians and civilian infrastructure, perhaps even to develop a new international convention to protect the built and the natural environments during war, and importantly, holding those individuals and countries who accountable who attack civilians and civilian infrastructure. We need to work towards finally, we need to support the primary prevention of war. This means resolving disputes without violence. It means addressing militarism, the global arms trade, and other underlying causes of war, and to strengthen the infrastructure for peace. In summary, most wars occur in low and middle-income countries where asbestos has been heavily used. During war and the post-war recovery and reconstruction, civilians are likely heavily exposed, and scientists and advocates and activists need to raise awareness about and to systematically assess and control asbestos exposure during war. Finally, I envision a time when there are no wars and no more exposures to asbestos. But until then, there's much work for us and others to do. Thank you.